My name is Beth Taylor and I am one of the clinical commanders in the clinical assessment team here at EMAS. In the clinical assessment hub we work over 5 teams. Throughout each team we have a mix of paramedics, nurses and mental health clinicians. We've got a good variety of different skill sets. I love that we create better journeys for patients because we can refer them elsewhere that's more appropriate for them. By doing that we're reducing ambulances being sent to patients, so they're there for patients that really desperately need them, and we're creating better journeys for patients. What tops that off is we really feel like we're helping patients when we can say we can manage them at home, we can offer them other services. That doesn't mean waiting for an ambulance, that doesn't mean going to A&E and sitting there for hours. So we get a lot of calls of patients, for example, with infections that the caller may think requires hospital admission, when actually we can assess these patients, look at their symptoms. If they have the ability, they can complete observations for us. We then use that information to think, actually, you don't need hospital admission, however, you do need intervention. Therefore, we might pass them to our clinical assessment services. We've also got virtual wards that we work with. We can still arrange home care. They will go out, they can assess the patient, they can prescribe antibiotics. They can do a lot more for the patient at home that then prevents them having to go to hospital when they are more comfortable managed at home. So I qualified as a paramedic in 2019. I worked face to face with the patients on the ambulances, responding to them, taking them to hospital. I saw this job advert in 2023 for the clinical advisor role. I liked the idea of it. I liked the fact that it was something different. It allowed me to progress. Telephone triage is a really good skill to have. I worked for a year on the phones triaging patients. Then November 2024, I had the opportunity to work as a secondment, so I'm currently working as a clinical commander within the clinical assessment hub. The positive thing about working across teams is that we always know our rotas. There are a set pattern of shifts, therefore you have good flexibility because you always know what you're working and when, and you can plan ahead for years if you particularly like to. So you get a nice work-life balance there. One of the big bonuses about working in the clinical assessment team is that we always tend to finish on time. We have regular breaks throughout the day, and we generally just have a good set of staff that work in here, and we have a good atmosphere, and it's a nice place to work. So primarily we work day shifts and we work night shifts, but there is flexibility in rotas for those that doesn't suit. The majority of us start at 6:30 in the morning. We come into the office, we get ourselves set up. We then have a Teams meeting which includes all the clinical advisors, mental health, nurses, paramedics across the sites that we work in, where we discuss the day, what it looks like, how the previous shift has been. Following on from that, we then pick up our first call. For example, that might be a fall where the patient needs assistance off the floor. We can either talk them through that or we can pass them through to our falls team. If you've got any problems, you can have a call, you can have a chat, you can welfare each other. So as much as we have our pressures, it is a good working environment and you are very supported.